I want to fill in some of the question, or answer some of the questions that Dave had brought up earlier, some of the issues that the Exchange Board has actually already made decisions on. And then I want to talk a little bit about, if we can't get it up, it's no big deal, but the special program that the Exchange is engaged in with the Office of the Healthcare Advocate to encourage enrollment and to try to get people motivated to enroll in an exchange plan or Medicaid and to get them engaged in their healthcare. And that is the Navigator and In-Person Assister program that we're launching in partnership with the Exchange. So I want to go back again to what David said earlier. The state of Connecticut has, or the board, excuse me, the board of the Access Health Connecticut, which it is now called, has made a determination that we would do standard design, a standard plan design. We did do that. We are in the process of finally approving the plan design. Lots of advocates and consumers really felt strongly that there needed to be an easy way to compare plans. It does make things more difficult on some other fronts, but we were able to come up with a standardized, plan design. And that plan design does include, as you may know, all of the essential health benefits. It includes a plan design option that the board had actually approved months and months ago. But the idea being that people could just compare price and networks going forward. And the board, because the standard plan design that we adopted is somewhat of a challenge, maybe somewhat of a challenge for consumers to easily compare, we did decide that it made more sense to allow the plan some innovation opportunities and to come in with a couple of additional options at each tier. So that is what the board has essentially decided. We did also decide on network adequacy that we did want independent monitoring here in the state, and the board did approve a strategy to allow the Exchange to contract for, engage in some kind of vendor association with someone to do independent monitoring of the networks. There are many people, including me, who felt that that was a very important thing for us to do. So we did, the board did approve that. We also approved an option, or not an option, we asked the plans going forward to disclose their network adequacy standards. So right now, under state law, plans must prove that they have an adequate network by certifying that that their network is adequate under certain accreditation standards, whether it's NCQA or URAC. But what we decided as a board was we wanted more than that. We want them to actually disclose the standards. So they're doing that. Also, an interesting thing here is early on, the consumers felt very strongly at the consumer committee at the Exchange that we needed to have consumer involvement in the design of the portal that is going to be the place that a lot of people actually go to shop for healthcare. And I will say the Exchange was very receptive to having consumers involved in the portal design. And as a result, we are having a demonstration of the portal tomorrow night in Middletown so that people can actually see how it works. So there's been a lot of involvement with that. There are people like me who think that there needed to be an effort around identifying who really is our customer here. Who are we trying to reach? Who are these 345,000 people in Connecticut right now that don't have healthcare coverage, be it Medicaid or private plan or another kind of public plan. So that kind of rolls me into this Navigator and In-Person Assister program. So the Exchange, or Access Health, I should be calling it Access Health CT, because that is its name now. We are required under federal law to have a Navigator program. And the Navigator program is essentially set up to hook people up to coverage by giving unbiased information about plan offerings, to help people figure out on more of a one-to-one or consumer-oriented basis how they can enroll in a healthcare plan. So the Navigator program did not come with federal funding attached to it. So the feds came up with an In-Person Assister program design. And what that is more of a real one-to-one assistance. It could be Christy and I sitting here trying to figure out, what plan options Christy might have available to her. And we did get a federal grant in the amount of almost $3 million to implement that program. OHA partnered with the exchange. We engaged in a long conversation about how we could help the exchange through the community contacts we have, design a program to be on the ground, helping people in communities enroll. We did not believe that everybody could come in through the portal. We have a lot of people in Connecticut whose literacy would not rise to the level where they could use the portal or needed some real one-to-one coaching. So what we did was say to the federal government that we will commit to you that we will design a program that will reach people where they live, where they work, where they play, and try to enroll them in coverage. So we have hired someone who's not here today, Kate Gervais, who's actually at an event related to this program, who actually went out and conducted a needs assessment across the state of Connecticut to find out who are our customers in each community. I don't know if it will surprise many people in the audience to know there are many counties in Connecticut where over 50 languages are spoken. Over 50 languages. So what Kate did was talk to people in every single community, and she got an idea of, you know, what are the income ranges where people live in certain communities? What are the neighborhoods like? What languages do they speak? Where do they work? Where do they go for trusted information? We felt strongly we needed to come up with a system where people could go to trusted advisors in their communities and get help. Whether it's VITA sites, the Voluntary Income Tax Assistance Program, community health centers, the community action agencies, the hairdresser down the street, the barber shop. These are all potential in-person assisters. So, I mean, we have a report, which I would be very happy to share with you, but I think it's more important to tell you that we have really engaged in a program by which we are communicating with every single kind of association you can think of on the ground, whether it's a small business association, a merchants association, a chamber of commerce, a clinic, faith communities, realtors, town health departments. We have gone everywhere around the state to make sure that we know who our consumers are and who we're trying to reach. So I just wanted to make sure we wrapped that piece into here, because ultimately the most important thing is that we get to people who need to be enrolled. And this in-person assister program is really, I think, the key to getting there. And OHA, I know, is committed to it, and the exchange, I think, is committed to making sure we get every single person enrolled in coverage we can get. So with that, I guess I would just like to open it up.